I think that this is the better way. It's not the number, it's all the process.
Currently, Greece does not offer non-anonymous donor eggs or open ID donors. Do you see it changing at any point?
Yes, of course. This is not true. Now, after some changes in the Greek legal rules, we are offering all this kind of donors. But the point is that we must realize that if we have the fresh donors and we are working with fresh donors, in this compartment, it may be more difficult to achieve the ID donor. Because, of course, they must agree, and all the parties must agree that it's not a very popular in Greece. Our better way, and most of our patients choose the anonymous donation. This is the reason that we are not able to offer to the patients a lot of donors with normal ID. In case that we are using eggs from the banks, this is absolutely possible to choose any donor ID release or non-ID release. It depends on the patients.
So how is Assisting Nature different from other clinics?
Assisting Nature is a very modern clinic with very modern facilities. It's established about from the place which is about more than 700 square meters in the very modern building, new building. We have all the departments and facilities in-house with PGT-A lab, embryology lab, microbiological lab, with possibilities to very quick response and very quick answer from the point of patients and doctors, that we are possible to have results of blood tests after 2 hours during the day, which is allowing us to answer very quickly for some disturbances, let me say, or some, if we want to double check some of our exams and results. Of course, we are performing also very detailed tests in our lab, checking and monitoring the quality of these results. That's, for example, with AMH, we are working on the last generation equipment, giving us the opportunity to have more detailed answers and results, comparing it with the past. Our lab has this time 6 embryologists who are very good level of working possibilities and abilities, very good taught in PGS and in PGT-A functions, and all this process of laboratory procedures. We use also time-lapse equipment to have, of course, confirmation about the divisions in the lab. We have genetists who are able to have genetic counseling in case that it's also important. We are working also with urologists, performing TESA and micro-TESA inside the clinic, and in the real time during the pickup in the second operating theater, we are performing, for example, micro-TESA and giving the opportunity to the lab to work more properly and to have a more proper and direct connection with men and women gametes.
So what is the highest BMI you will work with?
I would like to say that, of course, the BMI, it's a matter of risks in the IVF treatment and, of course, about the results in IVF treatments. Then, I can say that all is possible. And for the very experienced doctors and clinics, we have not the line that we are cutting the patient, stopping the therapy. But in every case, we are allowing patients and we are offer the period in which we are together trying to improve the BMI for the patient. And I think that this is the better way. It's not the number, it's all the process. Very personalized to start the real treatment in the point that the patients, in our opinion, of course, medical opinion, is able to answer to our treatment safety.
That's very reassuring to hear. Thank you. What medications do you recommend for a patient with multiple early miscarriages?
This is also a very smart question because all this field of multiple or recurrent miscarriages is under investigation for many, many years. Generally, we must remember that 80% of miscarriages is due to the genetic reasons. The first point is, my question, if we perform PGT-A and know that the embryos are euploid, yes, there is the space for the medication for the investigation in the field of endometrium. If we don't know about the euploidity of the embryos, I think that the first step is to offer to the couple this issue, this point. They must do the PGT-A to have the real answer. If we have the euploid blastocyst or not. If we really have, yes, this is the point to stop for a little and to investigate the cavity, the uterus cavity, and all another issues. And how to do it? Very simply, we offer the hysteroscopic fundus incision, the procedure which is now used in our clinic, and allowing us to check the uterus cavity, to perform the incision. And of course, in the same time, real time, we collect the sample for microbiome test and for ERA and implantation window test. This is allowing us to know, firstly, to create the better space for the embryo implantation due to the incision. Second, to check what about the microbiological flora inside the uterus. Maybe we have some disturbances there or something, signs of chronic endometritis, which is easy to treat before the transfer, and in the end to have confirmed implantation window time to be sure that this is the proper time for the embryo transfer. Of course, during the process of preparation of the endometrium, we use also corticosteroids, and of course, trying to to keep the patient's safety with using the heparin with small molecular weight, giving the safety of the process. But I think that this is up-to-date procedures now according to the miscarriages and these problems in the patients.
Why is your city, Thessaloniki, a hub for fertility treatments in Greece? And also, why is Greece an attractive destination for American patients?
Of course, Thessaloniki is a very beautiful town, and we have more than 9 IVF clinics. Very well established, very modern, with highly educated personnel, which giving us the highest level of facilities in this field. Also, Thessaloniki is placed about 60 kilometers from the Chalkidiki Peninsula, which is a vacation paradise that every patient can really think about connecting the medical procedures and medical treatment with some 3 days of vacations in very beautiful place. That for many patients we are offering even some transfer services from the airports to the near hotels in Chalkidiki, and then the transport from the hotel to our clinic for the procedures. That they are really not realize that they are in the medical treatment cycle. They are really in very beautiful vacations, fertility vacations in Greece.
Do you offer PICSI and embryo banking at your clinic?
Yes, of course, we offer all these procedures and many others, like embryo glue and another sperm preparation techniques, also DFI, also meiosis, sperm stress tests. All these procedures are possible in our clinic, and they are controlled by our embryologist and andrologist team, which is very important to have a specialist who are starting from the beginning, testing and then working with IVF procedures.
Robert, what protocols do you use for patients with PCOS, endometriosis, and adenomyosis? Perhaps let's start with PCOS.
Of course, it depends on the level of PCO, of the reaction, if we have all tests performed. But generally, we used the mild minimal stimulation protocol. It's now very modern and I think very popular in patients who prefer to have the stimulation more mildly and more safely and with more successful results. Sometimes it's needs to do it again and to collect less eggs, but with better quality and better potential in their divisions and fertilization after fertilization. That I think that all of this research concerning the mild IVF protocols now it's really in development, and it will be very next future, I think, in other countries.
What about endometriosis patients then?
Endometriosis patients, it's a very interesting also part of patients, because there the endometriosis play a very huge role in the process of IVF, and this is involving the quality of eggs, This is not involving the quality of endometrium and only quality of eggs. That, of course, we are trying firstly to treat the endometriosis, to stop the process of creating the cysts or to have the active endometriosis based on the factors that we are able to measure in the blood. That after this pre-treatment, let me say, we can start the normal stimulation with very good results. And if it's possible and if it's managed to do it, the results are very similar with another IVF project.
And what about patients with adenomyosis?
In this case, the hysteroscopic fundal incision is very, very important, to be sure that adenomyosis is not involving the cavity. And in this case, also, the incision plays a very great role to enhance the endometrial potential of implantation. That we are firstly checking and secondly offering this method to this patient.
That's it for today's interview with Dr. Najdecki. See you next time on IVF Off The Clock.